Everybody. Dan Bates, Greater Hamilton Chamber of Commerce, President and CEO, and we are so happy to have you here with us today. We have a great guest speaker on a really relevant and terrific topic, so we will get to that in just a minute. Um, I think, Laura, you're going to do self-introductions, but I'm going to introduce Carrie Yeager. I've had the pleasure of working with Carrie over the past few months with the Butler Cares Task Force. So she is the Environmental Health Director for the Butler County Health Department. You may or may not be aware, we have a Butler County Health Department, and then we have a health department for Middletown and a health department for Hamilton. A little confusing, but just kind of how it works. So, the interesting thing is, Carrie has a terrific background, but the interesting thing is she graduated from Miami University with a bachelor's degree in geology. But she went into public health, and that's where she found her passion. So you know who I am, you know who our guest speaker is going to be. I think that Carrie has a couple people going to be working with her during this presentation. But with that, I'm going to turn it over to Laura so we find out who all of you are who has joined us this morning.
Yes, welcome everyone. I'm Laura Merrill with the Greater Hamilton Chamber. So glad to have you all here today. So we'll just go around the screen. Tell me who you are and what company you're with. Lisa, we'll start with you.
Good morning. I'm Lisa Sandlin. With my company is Empower Works, where I teach people how to own their life, health, and wealth through education, design, and financial services.
Wonderful. Thanks for being with us. Steve.
Hello, Steve Wayne from Miami University Regionals. I am in employer relations there.
Jill.
Hi, I'm Jill Cates with Easter Seals Career Connection. I'm the workforce developer to help connect the youth in our program to their potential career.
All right. Adam, welcome.
Yeah, good morning. My name is Adam Gabbard. I work for Iron House Studios. We're a video company that specializes in telling stories and bringing genuine video to small and mid-sized businesses.
Wonderful. Glad to have you with us today. Lauren.
Hi, everyone. I'm Lauren. I'm one of the COVID-19 specialists with the Butler County General Health District.
Wonderful. Glad to have you here. Kara.
My name is Kara Presler. I also work for the Butler County Health Department, and me and Lauren work together to be the COVID specialists.
Wonderful. Glad to have you here. Tiffany.
Hello, I'm Tiffany Grubb, Director of Membership and Marketing here at the Greater Hamilton Chamber.
All right. Well, Carrie, we will let you take it away.
All right. Good morning. As Dan said, I am Carrie Yeager. I am the Environmental Health Director here at the Butler County General Health District. I have been here about 18 months now, but I have been in public health for almost 20 years. The last, 18, I was at Warren County. So I'm very familiar with the area, but born and raised here just outside of Hamilton. So I'm going to attempt to share my screen. So let's see if this works. All right, did it share?
Yes.
All right, so this morning we're going to talk about the resources that the Butler County Cares Project is providing for any business that resides within Butler County. And when I say resides within Butler County, that also includes anybody that's in the city of Middletown, where you might actually be in Warren County, but you are covered by the Middletown Health Department, or in the city of Monroe, where again, you could reside within Warren County, but you are covered by the Butler County Health Department. So how that works is if your city overlaps county borders, you contract with one health department to do all of your inspections and all of that. So again, I'm Carrie with the Butler County Health District. And so what we're going to talk about today is what is a COVID-19 education specialist, who they are, what resources do they provide, how we contact them, and what questions you may have. Okay, So we have hired 2 public health professionals that are going to provide free support and education to businesses. So this is not enforcement. This is not us coming out to yell at you. This is 2 people coming out to help you navigate those wonderful director's orders that are out there, which I'll be honest with you, I did not realize how many there were until I was, copying them for the girls. And there's a lot of them, and there's so many different things in them. We want to help you because be honest, when I look at them, I find something new each time. So our goal is to maintain a healthy local economy and to ensure COVID-19 compliance. We don't want to shut businesses down again. We want to help you continue to operate safely. All right, so who are our COVID-19 education specialists? Kara Pressler is, just started with this on October 24th. You can contact Kara at the email on your screen if you need help. And then we also have Lauren. She again started with this on October 24th. Okay, so what resources are we providing? So we are doing consultations on how to minimize the spread of COVID in your business. We are also going to talk to people about what a positive test means for your business. That is the #1 question we are getting right now. That is getting phone calls probably about every hour going, I had somebody test positive in my business. What do I need to do? What does that mean for my business? Can I stay open? Most businesses that are closing right now are closing because they do not have enough staff to continue to operate. We're assisting everybody with complying with the guidelines. We are giving out free COVID-19 safety kits. Okay, so those kits we'll talk about in just a minute, and then we have educational material and signage to give out to everybody. So consultations, they can either be in person at your business or over the phone, whichever you feel more comfortable with. We are going to provide answers regarding COVID-19, guidance after a positive test. We're going to review the current mandates to help you stay compliant, and then assist with the resources. So, things that we're going to do. What can my business do to be compliant? How can I make my employees and customers feel safe? That's the second most frequent phone call we get. I work for this company and I do not feel safe going into work. If your employees don't feel safe and your customers don't feel safe, they are not going to come in. So we're going to help you do everything you can to make everyone feel safe. What can I do to prevent the spread of COVID-19 in my business? And then someone has tested positive, what now? And what can I do better? And then how do the guidelines affect my business? Okay, so what is our COVID-19 safety kits? So they come in a Sterilite or Rubbermaid tote. They include bleach, spray cleaner and nozzle, 50 masks, an infrared thermometer, hand sanitizing wipes, and an 8-ounce bottle of hand sanitizer. All the simple things that businesses need to be able to clean and to be able to protect their employees and their customers. It's just a little starter kit to show you the different things that's out there and can be used. Now, there may be another product added to these kits. We are still waiting to see if that comes through, but it is a possibility that more things will be added to them. So a kit comes with a consultation. So if you want a kit, ask for a consultation. Again, it can be by phone or in person. But we do have 500 of these kits to go out into the community. And these kits were purchased by the Butler County Commissioners with CARES funding. All right, so what kind of educational materials do we have? We have all kinds of flyers and signs that we put together to help everybody navigate. So, 2 examples right here, understanding your COVID-19 test results. And that is a big one because a lot of people, they go and get tested and don't realize what that test means. So if you go and get tested for COVID-19, you are quarantined until your test results come back, okay? So it means you can't go to work, you can't go out in the public, you are at home quarantined until those results come back. Now, if you took that test because you were exposed to somebody, then you are still quarantined for the full 14 days from the time that you saw that person. Not until your test comes back negative, because unfortunately COVID can show up as little as 2 days, or it can take the full 14 days for somebody to start showing symptoms. If you took the test because you have symptoms yourself, if it's positive, you are isolated for 10 days from the date your symptoms first started. If you took the test just because you're curious, that's a little different. And then once you get your negative result, or if you were symptomatic and you get a negative result, then you're out of quarantine. So another thing that we're promoting is having teams. So having an A team and a B team. We do this here in our own office, where we have certain people work certain days of the week and we do not interact with each other. So if there's an exposure that takes out team A, you have team B there to still work, so that you are not losing a whole department, you're not losing your entire staff, you are not shutting down your business. All right, so how do you request a COVID-19 specialist? So you can contact us either by phone at 863-1770, or you can email into our Board of Health email. If you're either way, include the business name and your contact information. So what we'll do is we'll put you in touch with either Kara or Lauren. One of them will give you a call to either talk to you on the phone or set up for an on-site consultation. So again, thank you for letting us talk to you about our educational specialists. What questions do you guys have?
Hi, Carrie, this is Lisa. I have a question. Can you, I guess, clarify what an exposure would be?
Okay.
I had a recent contact, but then when I got on the CDC site and I went through their tool, it said that I did not have an exposure.
Okay, so an exposure is being around someone who tests positive, so a positive person, for 15 minutes within 6 feet. So if you were with them, and that's cumulative over a 24-hour period, okay? So if you were, so say there's somebody that tests positive, and then so they have a contact. If you were just in contact with that contact, you're fine. So that would be a contact of a contact. You're fine until the contact tests positive. Does that help at all?
Yeah, I just want to kind of give you the scenario so people can understand how tricky this is.
Right.
I have a Tri-County office. There were only 3 people in the office. I walked in, I had a mask on, nobody else did. I stayed within 6 feet of everyone except one person, and he actually walked by me, gave me a brief hug, walked on. And so that was my point of contact. That was on a Wednesday. And on Sunday evening, I had no clue. On Sunday evening, I got a text from him that he had tested positive. Tested Friday and got the results Sunday.
Okay, so that's a little different, because actually if you have physical contact with the person, it doesn't matter how long it is, that is contact. So that would make you a contact, depending on what day his symptoms first started. So from the day of your positive test or the day your symptoms first start, you go back 2 days. So if his symptoms didn't start until Friday and you saw him on Wednesday, depending on the time of day, it could be a little iffy.
Well, from what I understand, his symptoms had been going on for about 2 weeks, and this was his 4th test. So he had 3 negative tests. That's why he was still working.
Right.
And his 4th test came in positive.
Okay. That's a little different. And what I would tell you to do is to contact one of our epidemiologists to discuss that with them. They know the fine intricacies a little more than what we do. We're more high level up here. But we have, and I can get you the phone number for them to talk to them.
15 days out now, and I
Okay.
did pretty much quarantine and stay. I live alone anyway. But it's just, you just don't know what to do. I got conflicting information. I called my doctor's office right away the next morning, and she told me to quarantine. Then I got on the CDC site, and there was nothing about like touching like that. It was just if you had been in close contact for more than 15 minutes. So
Right.
according to that, I didn't have an exposure. So
Right.
I called my doctor back, and then they're like, well, no, we go by that CDC site. So you're good to go. You're fine.
Right.
So I mask and I try to be as careful as I possibly can, but
Yeah. So I had to learn about the touching aspect of it due to schools and due to sports. So that's where we learned about that being a contact. So like if you're playing football and you tackle somebody and you come down with COVID, that person's automatically a contact. Believe me, I've got people trying to do wrestling tournaments right now. So I have had to learn a lot about that contact portion and how many people that can take out. And, you know, that's why we should not be sitting on Santa's lap this year. Because if Santa's positive and people sit on Santa's lap, Santa's going to get everybody quarantined. So pictures with Santa from 6 feet away are fine. Just don't get any closer to Santa. And I know, you know, a way to help the kids with that is just tell them, hey, we don't want to get Santa sick if we want presents this year. You know, we have to keep Santa healthy.
do we know what the process would be? Say Santa is not positive,
Mm-hmm.
but a child sits on his lap that is without.
Then Santa would be quarantined, but all the other kids should be fine because then they would be contacts of contacts.
Okay. So that's where that secondary contact comes.
Right. That's where you have the secondary contact.
Carrie, I have a question, kind of two questions. You know, I think having the COVID specialist, you know, I've thought from the very beginning, it's a wonderful resource to business. So my first question is, have businesses been reaching out to them? And the second question is, how do we overcome the fear of, you know, that's the last thing I want to do is, you know, reach out to the health department and invite them into my business. So do you have any recommendations for that?
Yes. So we have had one person so far because we just sent out a press release last week and it was Thanksgiving. So we have had one business that has reached out to us asking us to come in. But just remember the health department is here to help you. We don't want you to close, and it's easier for us to come in before there's a problem than after there's a problem. So utilize us, utilize our skills. Don't be afraid of us. We are not even, so normally, you know, the things we do are restaurant inspections. Even with that type of inspection, don't think of it as adversarial. You know, you want to learn from us. We want to help you. We want to help you be better. We want to help you not make people sick. And with that also, just remember, we want to keep your employees safe too. Because if they can prove that they got COVID from your business, that's possibly a workers' comp claim. And we don't need anybody to have that. So just use us. Like I said, we are here to help. I have helped many a business. And I'll be honest with you right now, I have been through many an outbreak, and you want us there before that outbreak happens. So let us help you. We're nice, I promise.
Carrie, I have a comment and a question. First one, going back to Santa, yesterday on Facebook, I saw a community, I don't remember where it was in a completely different state. They had Santa in a plastic snow globe. Hopefully Santa wasn't claustrophobic because that seems like a nightmare to me, but it was really, the pictures were really cute. And then second, you may or may not be able to answer this question. Is there a difference between a rapid test and the regular test that you get? And
okay, yeah. So with Santa, any way that you can prevent the kids from that contact and being in a bubble is great because that's a barrier between them. I think that's an amazing idea. I know that Middletown had Santa in some kind of vehicle and they went around to all of the neighborhoods. again, that's great. Just whatever, we just don't want the traditional Santa pictures this year. Now, what was the second question again?
Is there a difference between the rapid test that you get and the traditional test?
Yes, there is. So the rapid test, even though it comes back positive, they still have to run the traditional test before they 100% consider you positive, because that rapid test isn't all that accurate.
So do they automatically do that when you get a rapid test, or do you have to get a rapid test and do you have to be tested twice?
That I don't know. I can find that answer out. But I listen to a phone call with the Ohio Department of Health every Wednesday. And that is the one thing that they stress to us, that you have to take I think it's called the PRC test for it to, and if you have that rapid, you have to take that second test. But I'm not sure if it's all in one and it just gets turned over or not.
I just want to kind of put in a testimonial here for not only the Butler County Health Department, but our own health department in Hamilton. I got a call from a local, one of our neighboring cities a while ago, and they wanted to know how in Hamilton that we, especially as a chamber, were doing some of the things that we were able to do, during the pandemic. And I just want to say, it's the help of the health department and following their guidelines that allowed us to do a couple of the things that would have otherwise been canceled. So, we followed their guidelines. We submitted a floor plan to the Hamilton Health Department of how we were going to manage it, just like State of the City, and even Hamilpalooza, which was a much larger but outdoor event. And so, for those of you who might be watching that are still suspicious, our partnership has enabled us to continue to do events safely and keep our businesses open. So, working on the, Butler Cares initiative, there's a lot of businesses that reach out to us here at the chamber and say, can we do this? Can we do that? There's certain things I just know and other things that I refer them when it gets into a question. It's a little more complicated. It goes beyond my expertise, but even things like Music on Main and stuff like that we just did successfully, we really focused on the guidelines, and made sure the businesses knew that with these new guidelines from the governor, unfortunately, they become somewhat liable to make sure that their customers are masked in their businesses. So I just wanted to say, kudos to, Carrie, you and your whole team. They've been a great partner here with us at the chamber, along with our own local health department here in Hamilton.
Yeah, and both local health department, or all three of us. So Jonica at City of Hamilton and then Carla at City of Middletown, they answer all kinds of questions all day long. Most everything that has been submitted to us, with the exception of one, we've been able to fit into one of our guidelines. So that's, what you need to do is, if you can fit it into one of the director's orders, you can usually do it. So we had somebody that was doing a brunch with Santa. The way they had it submitted wasn't, feasible, but we worked with them to show them how to do it safely. And that started with, let's not touch Santa. They wanted to have craft tables set up. We did have to tell them, no, you can't do craft tables because that's a communal area, but hey, why don't you do the crafts at each child's place setting? And as long as you do it banquet style, have the meal served to everybody, don't do it buffet, they could go forward with this type of, what they wanted to do. They just couldn't do it in the traditional sense. So that's what people have to remember, is we can still do things. We just have to modify how we do them and just don't do them the traditional way. But, then there's that, one thing that just couldn't figure out how to fit it into any of the orders. And it just wasn't a good idea. But like I said, we do our best. I took a week looking through every order there was, and I tried. Does anybody else have any questions? Kara or Lauren, do you guys have anything to add?
No, I mean, please feel free to contact us if you know, or you know of a business that, you know, needs a little love and support, please refer them to us.
I mean, me and Lauren come in and like we did yesterday, we went to many consultations yesterday and we're there to give you a tote, but to also walk you through what are you doing? And a lot of times they're doing exactly what they needed to do. And sometimes that's what the business needs to hear, that we're supporting you, that you're doing what you're supposed to be doing, because some of them are in a vacuum when you're a small business and don't know that everyone else is also struggling. And it's nice to hear that you're not alone. So it's not just education, it's also the support of, no, you are doing what you're supposed to be doing.
Tiffany, also, if you want to just explain to people that what happens to this is recorded. It is on Facebook Live, and how people can access it afterwards. Even members of the health department, may want to, share this with other groups or whatever.
Yeah, we'll put this on our YouTube channel also, so we can send you guys the YouTube link. And then I'm thinking we will put that YouTube link in our e-newsletter for businesses as well, so they can watch this back. And then, Carrie, if you could send me, do you have digital files of the flyers that you shared? We can also attach those to send to businesses as well.
We can do that.
Perfect. All right. Dan, do you want to wrap it up?
I would be glad to. I think this has been a very informative session. I'm probably more informed than some just because of being on the task force, but I learn something every time. So, I guess my big concern, which we've been pushing this since the idea first came out, this is a resource. And please utilize the resource. This is not enforcement. I am thrilled with this initiative, and that our commissioners put some money into, being able to bring in Lauren and Kara to really help the local business community. So, if you're a local business watching this, please share this. Please get the message out that this is a resource to help you stay open. And that's what this is really all about. This is not about shutdown. It's about how do we do everything we possibly can do to stay open, keep your customers and your employees safe. So with that, I want to thank Lauren and Kara and certainly Carrie for joining us today. And we thank you, all of us who have joined us either on Zoom or on Facebook Live. And have a great day, everyone. Thank you for joining us.